to Twins World, all about parenting. Hope your new year is going in very good pace, and I'm so grateful to all of you for subscribing this channel and liking and sharing these videos. Your inputs have really made so many changes in my presentation as well as the various topics I'm taking. And this session we are going to deal with toilet training. Toilet training or potty training is one of the major milestones in a toddler. And if you see the meaning of this particular word, we are training a child to use a commode or a toilet to pass urine or motion. So we need to understand that this particular toilet training is an achievement for the child because the child is able to control his voluntary muscles of passing the motion or urine. So this again add on to the autonomy of the child. In some culture, the parents or the grandparents start training them to pass urine with the sound and all. The child will accustomed to that sound and pass urine. So this kind of habit training you can see soon after the birth. But usually when science speaks to start toilet training from 18 months to 2 years, that is 24 months. But it is not mandatory that all children need to attain toilet training by 2 years or 3 years. We can expect the child to completely attain toilet training or potty training, that is to control the motion and pass urine, by 4 or 5 years. So if we are seeing the psychology of this, it is also said that Sigmund Freud is one of the very famous psychologists, said that toilet training also plays an important role in character or behavior or personality development in the later adulthood. So it is actually, I would say, a successful completion of a father or mother or any of the caretaker to make a baby or a child to attain the toilet training. We can see that when toilet training has happened, initially the child is able to control the bowel or control the defecation process than urination. That means the child needs more time to control the bladder, that is to control the passing of urine. A second thing we need to understand that the daytime they are able to control better, and later as days goes by, the child will be completely trained to control the bowel and bladder in the night time. If you see the potty thing, initially we need to understand what is the language the child is able to express when the child want to go to urinate or the child want to defecate. So before talking about how to help ourselves and the child for potty training, I would like to discuss about the two types of potty availability. So devices are available in the market where we can train our children for potty training. First one is a potty chair, where a toddler size potty chair is there with a bowl attached where the baby passes the motion or urine there, and we can clean it or drain it in the commode or the whatever facilities we are having. The second thing is a commode adjusted infant seat will be available in the market, where it is fitted inside so that the child will not fall inside or child will not feel shaky, so that the child have a better seat in the commode itself. Let's see what are the signs that shows the readiness of a child for a potty training. We need to understand that our neighbor's child has been potty trained. That doesn't mean that our child need to be potty trained. Wait for the signs where the child himself or herself shows that he or she is ready for potty training. Wait for that particular thing. And this age, that is 1 to 3 years, is the age where child enjoys controlling and passing shoo or poo all around, because they are controlling something inside the body of a person. If you see the signs of our children, we can see that the child is able to be aware about the body changes. Maybe our children may be watching TV, immediately they may get out to another corner of the room or to another room where no one is there. So that shows that our kid is able to understand the kid want to pass motion or urine, and he or she is feeling embarrassed to do in front of public. That is one of the signs. Second thing is the child will be showing a face that shows that the child is trying to hold on to himself so that he or she will not expel the stools out. So this is also another sign we can understand, okay, the child want to pass urine or motion. Actually, as days goes by, when you start your complementary feeding by 6 months, if your food pattern is structured and well enough, you can predict when your child want to pass poo, because if you're giving a 10 o'clock feed, you can expect the child to have a poo training or having an episode of poo by 10:30, because when you're feeding the child, when the stomach is full, there is an increased movement of the intestine. We call it as peristaltis movement, which helps for passing the motion. So by giving a structured diet plan or the structured way of giving food, more of liquids or more of fiber content, you can expect this is the time my child can go for a potty. Another sign of the child is ready for toilet training is they may say, "Mama, I'm pooping now." That means they may verbalize, or they speak out that I want to go to pass motion. Or we can see as the signs I told that our children can have moving out from our room to an empty room or a corner of the room, showing some grunting face, so that we are able to understand my child is trying to hold on to pass urine or motion. So these are some of the signs, and one of the last sign we can understand that our children starts hating wet diapers. They are telling, "Gee, I want to remove my diaper because it is wet." That is the golden time or the right time to tell them, in order to avoid your wet diapers, you need to sit in the potty and you need to start train yourself so that no poo or no wee in your diapers, and you can wear panties like Papa and Mama. This is the way we can make them verbally ready for starting the potty training. Let's see how to teach our child for potty training. First thing, as parents, I need to have adequate patience to understand that it is a little lengthy procedure, and I should be patient enough to teach him or teach her how to be in a commode to have a potty or having a shoo-shoo. So the second thing we need to understand that I need to make sure that the diet pattern is regular in regular timing, so that I can expect a rhythm or I can predict a rhythm in passing this motion and urine, so that this will mentally help me that okay, this is my time, I need to dedicate for potty training for my child. The third thing what we can do is give them the pants where they can remove immediately, that you can expect when the child is able to or the child feels that to pass motion, immediately he or she is able to pull down her panties or lift the skirt in case of a girl can be expected. So make them wear simple clothes at home so that the child will not be disturbed or delayed or having accidental passing of motion in the clothes or in the floor. The next point is when the child is on the toilet training period, try to avoid going out somewhere so that the rhythm won't be disturbed or the child will be able to adjust with what is practiced. Pick up the right potty for your child. As I already said, that two main things what is available. Either we can train them for a potty chair, and the other thing is a commode fitted infant seat. My children both preferred a commode fitted seat over the potty. They carried the potty on their head and walked around throughout the period when I wanted to train them for a potty chair. So once the child is able to prefer or to take or select what they want to use for a potty training, then we need to teach them how to sit on it. I always prefer to have a commode fitting infant chair, so that further it's easy for the child to adjust to the commode than having a transition from a potty chair to the commode. So once you are making the child to sit in a potty chair, make sure that the seat is fitting so that the shakiness of the seat may scare the child and child may go back to diapers and you may need to start from scratch. Now, other thing you can add to a commode sitting infant seat is have a stool so that the child can climb onto that to sit for a better adjustment. And second thing, while they are sitting on the commode, than keeping their legs hanging, that is more scary than keeping their legs on the stool, so that they have adequate support and they will be happy to sit on a commode. And when the child is trying to make attempts, make sure that it is an enjoyable thing and you can promise some rewards to them so that they feel happy that they could pass potty in the commode. As I already said, that understand the signals of passing motion or when the child is able to defecate. Tell them run to the toilet, that is the place for passing shoo-shoo or potty. So this way you can train them. Another thing what we can always keep in mind is There is something called bathroom language where the child friendly talk, that if they want to pass motion they can say poo poo is coming. So this way you are able to make the child to speak than talking I want to go to bathroom, or if the child want to pass urine, you can say I want to do wee. So this way child friendly or kid friendly jargons can be used so that it's easy for the mother and the child to understand. If your child is going for some play school or some preschool, tell the teacher or the supporting staff that these are the language the child is using to pass urine and motion, so that the child won't be get confused, as well as others are able to help your child in the right time. Clean the child immediately after passing motion and teach them to wash their hands after cleaning that area. Even though you are cleaning, along with you let the child clean his or her own hands. So later when you're training the child to clean the private area by themselves, they have the habit to wash their hands. And once you're washing that area, dry that area, and if you can put some powder so that the moisture can be absorbed, so there won't be any kind of rash will be happening on that private part. Now the important aspect at this particular time of toilet training I would like to explain is the itching of the perineal area or this rectal area where the child passes motion. Understand, this shows a sign of worm infestation, and this kind of itching happens when this worm lay eggs. So when they scratch, understand on the nails there is eggs of these worms, and by mistake this hands goes into the mouth, the circle of the worms will be continued and the child will be severely infested. So it is always advisable by going for a deworming from the time of 1 year, because every 6 months you can expect the child to go for a deworming after consulting with your pediatrician. Avoid screaming, yelling or nagging the child if the child accidentally passed motion on the floor of the bathroom. Understand it is a task and we all have gone through a tedious job to reach here, and even our parents suffered a lot to make me and you where we are. So if you are giving a negative approach for all these things or while toilet training, what is happening to the child is child gets scared because it's something new atmosphere, something new the child is going to take, and the child can go for a regression. That means the child is back to bedwetting or into diapers. Again you need to start from scratch. So always approach toilet training or potty training with a positive way by appreciating them and giving them rewards if they are able to complete the task successfully. Hope this session is good for you. Even though it is tedious and painful and we need a lot of perseverance to teach our children the toilet training, once the child attains, we are making our child an individual to stand straight for a future life. So hope this session is a blessing for you, and I bless all of you to have a good time of having patience and perseverance so that you bring up a better generation. Thank you.